The live stream's up.
Okay, Ron, are you on board? Can you hear us and everything okay?
Yes. Hear you fine.
Okay. Okay, being 6:30, I'll call this special meeting to order for the Facilities Committee. And roll call shows that all members are present along with other guests. For the record, Krista, it's my understanding there was no public comment. Is that correct?
That's correct.
Okay, thank you. Okay, so what we're gathered here is for the consideration for action to be taken at the request of the Red Cedar Racing for the Punky Manor Challenge as far as a change in attendance policy. So what I would like to do at this time is to open the floor up to Mark Thomas and to KT for those, because basically I think we've heard most of everything we're going to hear again, but I want to just, have it on record one more time. So Mark, I'll turn the floor over to you at this time to, in case there's been any changes or any updates you'd like to let us or make us aware of.
Right, thank you. Appreciate the opportunity to speak here. Yeah, I guess a couple of things that we'd like to reiterate is that, financially, without being able to race all of last season and kind of getting off to a slow start with, some of the activity with COVID and being restricted with our attendance and stuff like that early in the season, which typically are big events for us because it's just like the first Major League Baseball game, or the first time that you get to go to a high school football game, or the first time that the concert series starts up, or the first time that the church socials start. It's that anticipation, and those are traditionally always very strong events, which really put us in a good financial situation and kick off our season in the right way. And so we missed out on those opportunities as well. And I guess we're just hoping that we can end our season in a strong note, and make sure that financially we put ourselves in a position that can help us take care of items that we need to take care of in the off season, and bills that we have to pay, and those kinds of things. And then just, with all the other things that are going on, you have lots of events going on in our immediate area right here with Ridgeland. There's just the event that with the Humane Society thrift sale, and the farmers markets and things going on at Mabel Tainer and those kinds of things, and Fireman's Ball coming up in Colfax. And it's again we're not trying to be careless, and this isn't something that people have to come to. It's an option for them, and the people that do come, they get it. We've really seen people acting different. They know how to stay away from people in lines and with the restrooms and stuff, and those kinds of things. So and the fact that it's an outdoor activity, is another thing that there just doesn't seem to be much going on in our world right now, restricting outdoor activities, as far as events across the country, let alone right in our own backyard here. So, and then the other thing is, it's a big revenue boost for our community and for our county, and it can, and I know that will be welcomed. It always is, and help businesses stay on their feet, get back on their feet, you know, as everybody's trying to recover. So that's why we came forward, and, you know, we appreciate the opportunity for you to listen to what, you know, what we're doing and what we're thinking and what we'd like to do. And you know, we appreciate the, you know, everything during the season where you worked with us, and we're hoping that we can put this event in a really good place and, you know, allow it to happen. And it, you know, it's 3.5 weeks away, and so yes, that's what I'd like to say right now. So thank you.
Okay, thanks, Mark. Okay, KT, would you like to update us on anything new that you're aware of?
Thank you, Supervisor Maves. So here to give you guys what I know as far as COVID here in our community, we are at 5,111 cases. That's PCR positive cases. We have an additional 468 probable cases, and we're seeing that number come up fairly quickly because one of our health system partners is now using rapid tests or antigen tests for folks that are symptomatic. We have 145 active cases right now and 7 hospitalizations. We've had 37 deaths. And there have been some significant changes that I wanted to share with you even just in this last week. The case rate as the facilities committee had approved in the resolution last week on Monday, and then this week on Monday, would have been limited to 25% and then 0. We had cases over 90 cases for the week before. And so we would have had a significant impact to grandstand capacity based on the resolution that was previously passed. So that increase in cases has really come with some significant changes that I think are important for you guys to have awareness of. So in the nation and in Wisconsin, about 95 to 99% of what is circulating is the Delta variant. And that is important for a couple of reasons. One, they believe in the preliminary data that it is more severe, and that would, the data here in Dunn County is small, but that is consistent with what we're seeing. We're seeing younger people hospitalized and more people hospitalized. We're also seeing that the immunity, either natural immunity from an infection or vaccine acquired immunity or passive immunity from breastfeeding, is not as effective at preventing infection. And so that is reflected in a couple of different ways. We have more breakthrough cases, we have more reinfections, and we have more infants that are being positive. And we have had some very small people hospitalized recently. We're also seeing that this is really impactful for our children, and that makes sense. We've got, that's our biggest population of people that are not vaccinated and more susceptible for illness. In my active cases currently, we're at about 5.5% of our active cases are children under 9. That is an increase of almost 0.5% just in the last 10 days. And so that's concerning. Our numbers are big enough to move that percentage. It takes a lot of cases. So to even see that creep up is concerning. And then, like I said, the severity is concerning. So right now, I have 1 hospital in the region on divert. They're not taking cases. And I have 10 other hospitals that are at peak capacity. Hospitalizations are a lagging indicator. They lag after cases go up. It usually takes a couple days, 3 to 10, before somebody is hospitalized after they are infected. And so I expect that in 3 weeks, it will continue to get worse, just as it has in many parts of the country. I do not believe that Wisconsin or Dunn County will get out of this or without additional hospitalizations overwhelming our capacity. Those are the changes that I wish to share with you guys today. Thank you.
Mr. Chairman?
Yes, Mr. Miller.
Thank you. In terms of additional data for the facilities committee to consider as it takes up this public health issue. We heard, and of course are all sympathetic with the financial considerations of Red Cedar Racing. I think it's important, however, that the facilities committee also be aware of the private cost. If somebody does end up being hospitalized with COVID, a 6-day stay, a broad average for an insured individual is $38,000 out of their pocket. An uninsured person can expect to pay $73,000 for their stay. If they end up in the ICU, that number goes up considerably, $250,000. These financial considerations are at the individual level. And what we are talking about, the issue in front of the facilities committee as a public health issue, it is not about freedom of choice. It is about the public consideration as to whether or not the county should allow at one of its facilities, it doesn't control anything else, just its facilities, an event where in the middle of a pandemic with a variant of this virus that is highly contagious. We had that recent episode at the Dunn County board meeting, the end of July, where we had 7 fully vaccinated individuals who contracted the virus. Fortunately, because they were vaccinated, they did not end up in the hospital. But it remains the case that in Dunn County, our vaccination rate is still very low. We're just a tiny bit over 40% of our population that is vaccinated. We can expect in an event that brings people, even if they are outdoors, that there will be transmission. And the facilities committee should be aware of the private cost to the individual, and then the public cost to supporting the individuals in the hospitals, ones who get seriously ill, and God forbid, the ones who die. That cost to our local community, to our region, to our state, and to our nation is already in the billions of dollars. I think those financial considerations should be weighed against the kinds of financial considerations legitimate that the Red Cedar Racing has explained. Thank you.
Okay, thank you. Okay, so I'll open this up for discussion amongst the committee members at this time. Does anybody wish to speak? Don, yes.
Thank you. I have a question for Mark. On your August 13th race, it looks like you had 56% of your patrons were not vaccinated. 56%. Now, of those 56%, do you have any idea how many wore masks all through the race?
We do not know how many wore masks. So, because we were above a 50% allowance, so the masks were not required. We we do have people that do wear masks at our events, but I don't have an exact number for you.
Okay, any other questions by any of the board members? Deb.
I know I'm not a board member, but I did have some information. I believe it was Don had asked questions about fairs, or Dave, I can't remember who, but whether they could contribute any cases back to fairs. So I spent some time this week looking at different fairs because they are a highly attended event. And the one fair that I did find was the Wisconsin State Fair, which was held the dates of August 5th through August 15th. They had 841,000 people that attended the fair, and they could contribute the 46 confirmed COVID cases were connected to that event. So that's a pretty small percentage. They had no COVID restrictions at that fair, no requirements for people to mask or whatever other requirements might be made. So, that's a combination of indoor and outdoor events. I know they had their full grandstand shows. I know that they had all of their cattle shows and so forth. So I just wanted to share that information as a follow-up to our last meeting when that question was asked. So.
Okay, thank you. Anybody have any other comments or questions?
I could got one more comment.
Okay, go ahead, Don.
I was talking to my daughter this afternoon, and she's, as you know, she's a nurse, an OB/GYN nurse at Mayo here in town. And she says they've all been asked now to go on 2 more shifts per pay period. Those are mandated. That's in addition to the voluntary shifts they all have been doing. And she says that even Rochester fills up at times. They're constantly switching patients from one hospital to another. And that's just to compliment what KT said. And I think also there was something on the news the other day from the director of Mayo, Northwest Wisconsin. He says if this trajectory of infections keeps going up, their hospitals will be filled up in the very near future.
Okay, thanks, Don. Anybody else have any comments? Mike?
So if you feel that it's pretty serious, are we doing anything about outdoor events in Dunn County in general, like the football games and other outdoor events that they're carrying on? Are you doing anything to restrict any of those events? I guess that's more of a question for the health department, I believe.
So as we've discussed in the past, Supervisor Rogers, the health department has put out recommendations, but no orders. And so what we're looking at with the races is really a resolution that was initially put forward by the full county board and then additionally by the facilities committee. So in keeping with that, my department will put out recommendations and not orders.
Okay. Does anybody else have any questions or comments to make at this time?
I do.
Okay, go ahead. I don't see you, Ron, but that was you, right, Ron?
Yes.
Okay, go ahead.
Well, I was kind of skeptical about this COVID-19 thing. And, it couldn't happen to me or couldn't happen to anyone else. But you know what? 2 weeks ago, I contracted the disease. And it's real. I believe in it now. And plus, I got Lyme's disease at the same time. But I'm just letting you know that it is a problem and it's something that we should really think a lot about. That's all.
Okay, thanks, Ron. Does anybody else have any other questions as far as for anybody that's present here this evening? I'm just asking again because I want to make sure everybody has a chance to voice. So, okay, Don, you have another question?
Well, another comment, similar to Ron, I contacted the virus also. And I think it was at the county board meeting. And I'm very, very thankful that I had the shots because I didn't have a real bad case, but I was still sick for a week or so. And I think I still have some feelings. So it's nothing to be trifled with.
Mike, you have another question or comment?
Yeah, I guess I have a comment. And I do take it, I take it very serious. I also have had it and understand it's serious. I also, as most of you know, have a little more opinion that we should allow people to make some of their own choices as well. So if we do vote on it, I will still support the people making their own choice and allowing them to go to the races. If that vote's put in front of me, I'll vote in favor of that.
Dave. Go ahead, Dave.
As I think last week or at our last meeting, KT, I asked the question about outdoor events, if anything's been contact traced back to outdoor events and they hadn't. Would masks, if masks were required at something like this, would that kind of ease your mind, KT? And do you think being outdoors with masks would be something that would be all right?
I think that is a challenging question, Supervisor Bartlett. I think that a multi-layered mitigation strategy is important. I think that keeping physical distance, wearing a mask, and getting vaccinated are all very important tools in the prevention tool belt. I don't think that I would be comfortable, and I would go back to the conversation that we had around hockey, that when our hospitals are full, we don't have the ability to have people treated for an appendicitis or a car accident or a heart attack. And I wouldn't want to bring together an opportunity for any kind of super spreading event where we would, again, put an additional strain on the hospital system.
Okay, does that answer your question, Dave?
Yes.
Okay, thank you. Okay, so if there are no other questions, then the reason we are here is to act upon the request to change the attendance policy. And we all know of the policy we have in place now. That is the official policy. And that is, what we're working off from right now. So the question that I asked the board is there a motion to change the existing policy, leave it as is, or something else? So I'm throwing it out to the board. This is a time to, if you want to change policy, this will be the time to make a motion, and we'll, act upon it, discuss it, et cetera, just like we do all motions. So. Okay, I'm asking again, just so everybody, yes, Mike.
I would make a motion to consider opening up the Punky Manor race if everyone wore a mask in the grandstands.
Please clarify opening up. Do you mean 100% attendance?
Yes, sir.
Open up, okay. Okay, a motion has been made to open up the attendance to 100% with masks being worn. Is that correct, Mike? Did I quote that right?
Yes, sir.
Okay, a motion has been made to that. Is there a second to that motion? Again, I'll ask, a motion has been made. Is there a second to the motion? One more time, is there a second, a second to the motion to open it up to 100% with masks being worn? Seeing none, the motion dies on a lack of a second. Mark, you have a comment?
Yes. So with no second at 100%, would the committee consider a 75% or 75% number of allotted tickets, which is 1,098 tickets?
Don,
I'll make a motion that we retain the present system that we have been using. And the reason I do that is because the county government is basically giving its blessing to this situation. And I think it implies that it is a safe way to go about things. And so I would not be comfortable with anything other than.
okay, a motion has been made to keep the current policy in place. I'm going to ask for Mr. Miller a question on that. The fact that it is already in place, does there need to be a motion to keep it in place, or the fact that if nothing else happens, it just stays in place, just for procedural?
Procedurally, it doesn't require a motion. It doesn't hurt, I suppose. Although if the motion fails, it also does not negate the existing policy. But it is not a necessary step to take. If this facilities committee does not make any motion to change anything, it remains as is.
Okay, thank you for
Okay,
clarification.
then I'll withdraw the motion then.
Okay. So, are you gonna, okay, Mark, go ahead.
Yeah, I just, I guess where we're at is that, we have people that are contacting us left and right here. So, that's why we're trying to bring this forward, and see if we can get get a set number or set percentage that we can go ahead and continue to plan the event for, and so that we can answer some of these questions, I guess. But so again, I'm going to ask about that 75% number.
Okay. Dave, go ahead.
If, supposing the committee doesn't change anything and the numbers are what they are now, what would the grandstand be, the number be at this time in the grandstands?
0%.
Okay. Could they have vaccinated people in the grandstands? I don't remember what our resolution said. Yes, that's what I thought. And Mark, those numbers that you gave for August 13th, the seniors and the students, I thought you said you didn't ask those whether they were vaccinated or not. Am I correct on that, or did you know whether they were?
We did not ask them, correct. We have,
Okay.
like I spoke at the last meeting, we had signage up, and then KT and I conversed, and we didn't understand the HIPAA regulations and all that, but it is okay to ask. So then on the next week, which was the 20th, which is the last time we raced, we did ask, but we only had 290 people. So we never even got close to the ticket number, that was allotted, which was 370.
All right.
366 was the ticket number.
So there's a good chance that you had 50% of the people in the stands were vaccinated. Because there's a pretty
Yeah.
high percentage of senior citizens that are vaccinated, a lot higher percentage of senior citizens than any other group.
Yeah, probably. Yep.
So would you be able to hold your races and say that only vaccinated people could come in, or is that something that would not work for you at all?
No, no.
There's
No.
other events that's going on that you have to be vaccinated to attend.
In where, in Dunn County, in here, around here? I guess I haven't.
Around the United States.
Oh, yeah. That I'm not sure about, but, I guess, so we know it's not 100. We asked 75. Okay. Can we go down to our 60% number of allotted unvaccinated tickets, which is 879 tickets? That is potentially something that could work for us.
Okay, is there anyone that would want to make or consider that? So what you're asking, Mark, is to have 879 unvaccinated people? Is that what you're asking?
Up to. Oops, sorry. Keep
Oh.
hitting the mute button the wrong direction. You got me, Chuck?
Yeah,
Okay. Yeah, that's our 60% number right now. That's the allotted number of tickets would be 879 unvaccinated, and then with vaccinated not being counted against that.
Right.
Yeah.
Okay, is there anybody that would want to make that motion as far as unvaccinated at 60%? I'll ask the question again, just so we have, everybody understands. I see no hands. Mike, go ahead.
I'll second it if someone makes the motion.
I'll ask the question again. Does anybody make the motion to go at a 60% unvaccinated level, which would be 879 tickets? I see no hands. Okay, if there is no more motions, then the existing policy as we have it today will stand in place. One last chance. Is there anybody that would like to make another motion for the facilities board to consider? Seeing no hands, Therefore, the existing policy as we have it in place will stand as the policy we go forward with. And being no further actions on the agenda, this meeting will be adjourned. Thank you.